out, because we don't just do things because we think it, we make sure beforehand that there is a need. And I'm very grateful to my colleagues to my right for doing a lot of work with our partners. We had a whole body of people working with us to develop the Masters in Commissioning, which you're going to hear about now.
I'm really fortunate here in the University of Wolverhampton in that the School of Health and Wellbeing has got quite a significant reputation. It has extended its reach. It has highly professional staff, very innovative staff, very entrepreneurial staff.
I think there's four key drivers around that case for change. First of all, the demographic challenge that we face. Secondly, expectations and the rising expectations of the people that we serve. The unprecedented financial challenge we face, and I use that word unprecedented carefully, but I don't think we have ever been in the financial climate that we're in at the moment. And then the policy imperatives that I will argue can only be delivered by joint commissioning and agencies coming together.
In a purely commissioning-led system, with a mixed economy of care, actually it's the commissioners who are the local NHS, who are the local social care service. If you take this to its logical conclusion, the people responsible for deciding what kind of services are needed for an area are getting those services and making sure they're delivering what they're meant to on behalf of local people.
The need to reduce the cost of management and back office functions to maintain frontline services serves to emphasise the need to work smarter. By increasingly complex tasks and increasingly complex systems, we'll have reduced human resources to work with as public expenditure as a whole and the proportion of it spent on management is driven down.
We firmly believe in education in collaboration with industry experts. From the quote on the slide there, I picked this from the university's new strategic declaration. We are an employer-focused university connected with our local, national and global communities, and we aspire to deliver opportunity and academic excellence.
Now, my definition of commissioning is the classic commissioning cycle of assessing need, of deciding what your priorities are, of then designing services, of procuring either within the public sector or between the public and the private sector, then purchasing those services and then holding those services to account.
They absolutely get this because every day there's 1 million people in surgery today being seen either by a practice nurse or by a GP, and the vast majority of them are in there with some form of long-term condition. And so the GPs instinctively understand that to commission services differently, they need to really grip the LTC agenda.
In fact, somebody said to me earlier when they were talking just before we came in that they were really looking forward to the day because they wanted to be stimulated, and I think that's definitely very stimulating. So well done, and thank you for doing such a fantastic job.